Hello, everyone. I'm Yutaka Osuga, the president of Japan Society for Reproductive Medicine. On behalf of our society, I'm really pleased to introduce our society, Japan Society for Reproductive Medicine, JSRM. Our society has a long history. Established in 1956, the pictures here show the first meeting held at Keio University. From the beginning, our annual meeting had a lot of audiences. The objectives of our society is shown here. It includes both basic and clinical aspects of reproduction and health of humans, livestock, and other animals. This is the structure of our society. The size is relatively big, having more than 5,000 members. 64% of them are OBGYN doctors, while the remaining are urologists, basic scientists, embryologists, nurses, and so on. The governance of the society is stable under the executive board, which consists of 25 members. Activities of the society are run by committees shown here. When I became the president of the society 2 years ago, I set key challenges shown here. Many of them are continuing from the period of the previous president, but I dare to underscore number 4, addressing internationalization, and number 5, strengthening our ties to the community. With regard to internationalization, I'd like to welcome activities to stimulate communication and collaboration between our society and other national societies. So please contact our society if you want to develop any mutual activities with us. Here are the main activities of our society, namely annual congress, commendation, certification, publication, registry, ethics, and outreach. I'll explain in more detail. Every year, we hold a national congress for 2 days, usually between November and December. The number of attendees is around 2,500. During our long history, we also had 2 big international congresses. In 1971, we held 7th World Congress on Fertility and Sterility in Tokyo and Kyoto. This is the program. You can see here the names of directorates of IFFS at that time. In 2015, we had a IFFS JSRM international meeting in Yokohama. The joint collaboration made the meeting successful, and many foreign visitors came to Japan and enjoyed the meeting. The next topic is the Reproductive Medicine Practitioner Certification System, which we started in 2002. The training period is 3 years or more after obtaining general OBGYN or urology certification. The training is systematic, while the success rate of examination is 65% in average. The total number of certified doctors is 920 as of 2021. This system supports the high quality and high standards of reproductive medicine in Japan. Along with the high quality of our training system, the academic level of reproductive medicine in Japan has been evaluated high. We've been publishing a journal, Reproductive Medicine and Biology, since 2002. The most recent impact factor of the journal is 3.239, ranked 28th out of 83 in obstetrics and gynecology, and 15th out of 30 in reproductive biology. We also publish a guideline and a textbook. Based on our society's guideline, coverage of ART by National Health Insurance has just started from April this year. The application of National Health Insurance to ART has a big impact on infertility patients in a country, since many of those had a huge economical burden or were not accessible to ART due to economic concerns. The next is our registry system. The registry system is led by our mother society, the Japan Society of Obstetrics and Gynecology, JSOG, but has virtually been supported by our society members. It started in 1986 and has been operated by an online system since 2007. By this registry, cycle-specific information for all ART treatment cycles performed in ART facilities in Japan has been collected. In the next couple of slides, I show some indicators provided by our registry. The number of live births through ART is just over 60,000 in 2019, and the figure corresponds to 1 per 14 total births in Japan. As you can see, most of the babies born by ART are from thawed embryo transfer cycles in Japan now. These are the rates of pregnancy, live birth, and miscarriage by age in 2019. In line with the well-known tendency, live birth per cycle is over 20% under age 35, but drops in higher ages. This graph may show some characteristics of ART in Japan. The peak of total cycles and that of ET cycles are at very high ages, 40 and 39 respectively. The peak should be moved to a younger age to achieve better outcomes as a whole. The implementation of coverage of ART by health insurance, just started, may promote the change. In contrast, a good feature of ART in Japan is a low rate of multiple pregnancies. After the introduction of single embryo transfer policy by JSOG in 2008, the rate of multiple pregnancies dropped sharply and has been kept around 3% these years. Meanwhile, the pregnancy rate per thawed embryo transfer has been slightly increasing. In terms of academic activities, we are developing SIG performances, small interesting groups. Last year, we started these SIGs. We're going to increase the areas in response to the demands of the members. If issues are examined and discussed in ethics committee, they also produce proposals, statements, and guides that are important for our members. I show here, for example, the products since 2018. We conduct outreach activities with the aim to strengthen our ties to the community. To name a few, media interviews, lectures targeted at the general population, and information on our homepage. Here's the sample of providing the information in our homepage. The contents are frequently cited as one of the most authentic references in Japan. Here are some of our future endeavors: improvement of practices in reproductive medicine, promotion of academic activities, contribution to health literacy of patients, development of international exchange. That's all for today. Thank you very much. Thank you for your attention.